The study by Dr. Roy and colleagues is a very important study. It's a kind of proof of concept that these new diagnostic techniques can be very much of help. For instance, in winter time when the hospitals are flooded with patients. I've seen that also this winter in my hospital. And with these very sensitive and rapid tests, we can detect all kinds of respiratory pathogens, viruses, very, very rapidly, which in the past we could not do.
Our findings in a period from January to May of 2018, covering the flu epidemic we faced in Europe during that time, was in around 1,000 patients. We diagnosed a positive respiratory viral infection in over 65%, and that's in the absence of any other associated bacterial infection. We found that within this population around 50% had flu. However, more than around 50% had other viruses associated, and that's why this comprehensive panel that we have employed is going beyond just detecting influenza, but a whole panel of 18 viruses and 4 atypical bacteria. This is all in a package of care that can take 45 minutes to have a result, whereas previously in the laboratory it was taking 2 days to get the same result.
It's very, very important for the clinical practice which we as pulmonologists see in winter time. Sometimes we are overflooded. And I saw in the winter, last winter also in my hospital, that by doing a rapid test for influenza, for the first time in my career I knew that patients entering the hospital, we diagnosed really that it was influenza. And this really affects the management, less use of antibiotics, and it also affects the movement of the patient into the hospital. So it's a very important study.
The logistic steps that we removed by having the machine by the patient's bedside almost is the factor of time in a porter transporting the sample to the lab processing the sample, booking it in, providing a result. That could take up to 2 days. These are the initial steps for this study. We still have a way to go, but the next steps I would like to do is further randomized controlled trials and also incorporating other algorithms and pathways of care and how we can, in a real life setting, say if we have a viral result, if we have a biochemical indicators and radiological indicators, how do we put it into a package and then provide the best care for the patient? So that will take time, but it will come hopefully.